so good to have you on the show today.
Thank you very much.
We're looking at the uterine fibroids and the fertility, no doubt.
When we say uterine, we mean that it has something to do with the uterus.
Yes.
The uterus is the womb. And then the fibroids are what we call masses or growths that occur within the uterus. And that's why they are called uterine fibroids.
Yes.
Okay? The good thing is that they are very benign. Benign meaning that they are not cancer. And they are very, very unlikely to become cancerous.
Yes.
They stay on the womb. They're like balls, small balls. They can range from as little as 1 centimeter to as big as maybe 15 or so centimeters. And then depending on where they also occupy within the womb, they are also named, differently. So, for example, if it is within the wall of the womb, we say it's intramural. Intramural is just within the wall. Intramural.
Yes.
If it is facing, if it's on the outside of the womb, we call it subserous. If it is within the cavity of the womb, we say it's submucous or subendometrial.
So in very clear terms, these are unusual growth around the walls of the womb.
Yes, so they grow from within the wall of the womb.
Yes.
The good thing is that they are benign.
They are not cancerous.
They are not cancerous.
Fantastic.
And they are not likely to spread from where they are to other places.
So
Being a black woman is actually like a predisposing factor to having uterine fibroids. So we tend to have it more in the black. It doesn't mean that other races don't have it.
Yes.
But we tend to have them more in our race, and also they tend to be quite big.
Okay.
Being young. So if you are within the reproductive age group,
Yes.
you might be at
You're
risk,
exposed to it.
yes, of having.
What has age got to do with this?
Well, we think that the hormones that women produce, estrogen and progesterone, have a role to play in the growth of fibroids.
Yes.
So when you are still producing those hormones, fibroids might grow. But we notice that by the time a woman gets into menopause, the fibroids they used to have tend to shrink. So that's why sometimes, for some women, menopause is a blessing because all the symptoms they used to have from the uterine fibroids will go away. So age is very, very important. The family history, if you have a sister or a cousin or a mom or an auntie who has uterine fibroids, there's a high possibility.
So it's likely. What are the possible ways women could know that they have uterine fibroids, like the symptoms of uterine fibroids?
Just like you said, many people that have fibroids don't even know they have it because many of them don't have symptoms at all. Some fibroids are so small that they don't even disturb you. But fibroids, when they start giving symptoms, could start by causing excessive menstrual flow.
Yeah.
So the woman that used to bleed for 3 to 5 days normally starts bleeding for 7 to 10 days. And the bleeding is more than it used to be. Maybe she used to use just 1 pad a day. Now using 6, 7 pads a day. In fact, sometimes they get flood. Sometimes she's so tired after menses, she's anemic. So bleeding, excessive bleeding during menses, prolonged bleeding, all of them could be. So the woman could also experience pressure symptoms. What do I mean by that? Because the swelling is there within the pelvis, and the womb is between the bladder and the rectum. So they tend to get to go to toilets. Especially when they want to go and wee, they tend to wee a bit more frequently than usual.
Yeah.
And they drink some water and she's running to the bathroom to empty her bladder because the bladder can't fill up the way it should. And then some women, the fibroid is pressing on that bladder and not allowing it to expand the way it should. And then because of the mass, it can sit on the rectum, which is the area that leads to the anus, and cause constipation. So she might have bladder symptoms, she might have, intestinal. Like I said, many people who have fibroids, no symptoms at all. But if you start bleeding excessively, start having pressure symptoms that you never used to experience, in fact, some people might even have it so large that people think they are pregnant, affecting anything. Fibroids on their own don't even cause infertility.
Yes.
But there are times when,
the placement of the fibroid also
the
could.
location
Yes.
could be a problem.
Disruptive.
Yes. For example, if it is blocking the tubes. I mean, if it is in a place where, for example, if you are, but this is rare, but just in case it blocks the two tubes, it could actually lead to that. In what's it called? Some fibroids, because they're located, if it's within the womb, it might affect implantation. You know, so some women, they get pregnant with fibroids, but they now have miscarriages, you know, or they end up having preterm deliveries. Preterm deliveries can lead to death of those babies. So that woman that she's carried the pregnancy, but because she's not allowed to carry the pregnancy to term because of fibroids, it becomes an issue. So you can actually do expectant management where you just watch and to see whether it will grow inside. Some fibroids might not even grow bigger than that thing you're seeing. So it's not every fibroid actually needs to have anything done about them. 70 to 80% of women, according to studies that have been done, would have at least one fibroid. So, you know, minimal access, and then you can do, you know, surgery.
Yeah.
You know? So minimal access means, you know, surgeries where you use very small incisions using cameras and long instruments, what we call keyhole surgery, to deal with the fibroids. And those things are available here, so it's not science fiction. A lot of our colleagues are able to do those surgeries, you know, without having to completely open you up. Okay. If it is one that is inside the womb and is causing excessive flow, we can actually use the same kind of cameras and things like that to scrape it off the lining. You know, something we call a transcervical resection of fibroid. We do that via something called hysteroscopy. Medical management, for example, if a man is bleeding excessively, we have medications that we can use to try to prevent, you know, or even reduce the amount of bleed they see every month. So we can use, you know, what's called non-steroidal anti-inflammatory. We can use all those modalities to treat. But I mean, so for a woman who is still desirous of pregnancy, she is young, you know, or she just wants to keep her fertility.
Yeah.
So you can actually do something called a myomectomy. And what does it mean? Just take out the fibroids and leave the womb.
Like a cesarean.
Well,
Probably just like a cesarean section.
But it may be the same incision they use for cesarean.
Okay.
But what you are doing is that you are taking out the fibroids one by one and then repairing the womb. So it's like a plastic surgery on the womb after you have taken out
This is the fibroids, yes.
You know? So for women who don't now want fertility, who are saying, I don't want to have any kid again, and they have enough kids, you know, and they are no longer desirous of fertility. You can do hysterectomy, where you just take out the womb.
Wow.
Yeah, and then you can, if that is the safest thing to do. We have had patients that will come and tell you that they've had myomectomies, which is the other one, 2 or 3 times before they are coming to you. By the time they are going in a 4th time, it might not be very safe to do it like that anymore. The best option, you know, for that kind of patient might not be to take out the womb and save her life, especially if she's still having very bad symptoms from the fibroids. One they call uterine fibroid embolization, and I have a colleague of mine who does that here in Lagos too. You know, and what they do basically is that they would inject something to sort of block up the blood supply to the fibroid. Yeah, so the fibroids shrink and they die, and the woman's symptoms improve. You know, there are concerns about fertility with that kind of thing, because if you cut off blood supply to the womb, you know,
it could affect blood supply
to the baby if she gets pregnant. Although new studies are coming out to say, look, it might not be the case. Yeah. Okay, there's even this new one they call, HIFU. There's another center that does that, high intensity focused ultrasound. You know, where you just focus on the fibroids and use ultrasound waves to burn it. Some people use laser, but you know, on laparoscopy. So there are emerging, you know, that some of these newer ones are not as widespread as laparoscopy, but they are here and they are available.